So anti-anxiety as well as atypical anxiolytics. So we already know we have benzos or benzodiazepines. Now the entire pharmacology field will add so many nicknames to this. Benzodiazepine, sedative, hypnotic, anxiolytic, and it's like, oh my gosh, like a rap. Sympathetic, epileptic, catecholamine, alphabetic, pseudostratified squamous epithelium. What? So just relax. We're gonna take care of it, okay? These are just nicknames that you give different drugs. So, yeah. Benzodiazepine, though, is probably what you're gonna get on your test. Now, it is a sedative. It is a hypnotic, and it just basically brings down anxiety. And I have an entire benzodiazepine and barbiturate lecture. But really, this is just kind of for your test and overview. And I'm going to include this little lecture at the end of this video, okay? So we're going to go more in depth. You're going to understand why I call these LAM and PAM. But this is just pretty much for your test and overview. Now, the next one that I will get into as well is your atypical anxiolytic. Basically, your atypical, fancy words for it's not a barbiturate. And you guys are thinking, what the heck's a barbiturate? Well, I include it with the benzo lecture at the very end. So, remember, wait for that lecture. Okay, so it's non-barbiturate and it's non-benzodiazepine. It's different. Yeah, I'm different. My benzo missing. Pull up to the scene. My benzo missing. So that's right. Your non-barbiturate atypical Buspar is different. Okay? Yeah, it's different. It's not a benzo. It's not a barbiturate. It's way different, and we're going to get into that right now, pretty much. So first off, your benzodiazepines. Benzos, they decrease what's known as your GABA receptor, and I call GABA your mother. That's what my pharmacology teacher taught me. She was saying that GABA is your mom. GABA is that little person in your brain that holds all your cognitive, rational decisions. So, when you drink alcohol, GABA is decreased. Benzodiazepines pretty much do the same thing. All your rational thoughts and egging houses and having your beer goggles on and probably singing at the top of your lungs are probably not smart things if you drink too much alcohol after your tests and go out and party. Now, your GABA receptors will be decreased, or basically, your GABA will be decreased or be sedated as a sedative. And usually we give our benzos for seizure patients. And benzodiazepines are very strong. They act very, very quickly. It's almost like the albuterol, if we will. It's very fast acting, as albuterol is a bronchodilator for the lungs. Or Novolog is insulin, very fast acting insulin. Benzodiazepine is a very fast acting, one of the most fast acting that we can give for an acute reaction. So, these end in LAM and end in PAM. So Xanax, Valium, and Ativan are your trade names. The almost like saying, hey, it's Coca-Cola, it's Pepsi, it's Sprite. Well, what is it? Well, it's a soda. And see, these are the generic names that they kind of practice under. Okay? So, when you drink alcohol, your GABA receptors are decreased. So you have decreased motor skills, obviously. That's why they make you do that walking gait if you're drunk. Same thing. It affects the same pathways here. You have decreased motor. You have decreased heart rate and blood pressure because everything's being relaxed. Your brain that controls your blood pressure and your heart rate is being relaxed. You have decreased level of consciousness, and it's like booze, like I said here, okay? Now, no drinking, what's called ETOH. No drinking on this because you're going to create a synergistic effect if you drink. like booze. You're going to create more decreased level of consciousness, more decreased blood pressure, more loss of motor skills. And patients can go into comas, and they can be sedated and even die from having too much sedation. Okay? No narcotics, because this affects our central nervous system. So narcotics is a no-no. Antipsychotics or SSRIs are a no-no. So make sure to write these down, because we do not want to have synergistic effects and shut down your brain altogether, okay? So write these down, guys. I will leave it right here so you guys can see the whole screen if you guys want to pause. But we're going to go on to atypical Buspar next. So the next one is atypical anxiolytics, the non-barbiturate, non-benzo, that's called Buspar. You guys want to write that down? Busaprone is the generic name. Now, it's not a GABA blocker, okay? So it doesn't block these GABA in the brain. It acts on a different system. That's why it's non-barbiturate, non-benzo, and that's why it's less addictive too. So there's certain particular things that you have to know about this. It's given for general anxiety, but specifically panic disorders, OCD, PTSD, as well as social anxiety specifically. So, yes, anxiety, but these specific types of anxiety it's given for. Now, it reacts on a different pathophysiological mechanism of action. Basically, it's affecting the brain a different way. Fancy words for, you locked yourself out of the house. You can go in through the front door, that gets the job done. You can break a window and get in. You can go through the garage door, the basement door. We're accomplishing the same thing in terms of anti-anxiety. We're just doing it by a different route. If that makes sense. So, benzodiazepines decrease GABA. Barbiturates, same thing almost as your benzodiazepines. Buspar does it in a different way. So, what happens is it binds to serotonin and dopamine receptors in the brain. Now, if you guys have seen my introduction video, whoa, man, there we go. You would know that serotonin, I have an acronym, SER, and that stands for sleep, emotion, as well as remembering. So when your patient is taking this, it's going to delay your sleep, delay emotion, as well as delay your memory recalling, okay? Because if we're binding to these dopamine receptors, basically the neurotransmitters are acting as a communication source and going from one cliff to the next cliff, or basically one neuron to the next neuron. So it's supposed to jump over this synapse here. But it's almost like a telephone game. Now, if we're blocking the receptor from one telephone game, the messages get delayed a little bit. So, we're just delaying the response, serotonin and dopamine. Now, dopamine has our other acronym, is our DOP, and that's your determination, obsession, and pleasure. So you're going to have less determination, less obsession, which is a good thing, but less pleasure, not so much, kind of a bad side effect here. But the good thing is that there's no sedation. There's no synergistic effects with other central nervous system depressants. That's just fancy words for your patient. Not like benzodiazepines. They have to really stop drinking, stop narcotics, and it even reacts with other medications like antipsychotics, like Haldol and Geodon, which we'll get into. and your SSRIs like Prozac. Okay, these BoostBar has no pretty much synergistic effects or piggyback effects. They're not going to work together to sedate your patients, and they're not going to get your patient addictive. So this is kind of a cool little choice for your patients to be able to use these, because we're really just doing the same effect. Our main goal is to decrease anxiety. And if we can do that by going through the back door, fantastic. We don't always have to go through the front door like our benzos, and we really don't have to sedate the entire brain, if you will. So your side effects for your central nervous system is you have a headache, you can be dizzy, also nauseous. Really everything gives nauseousness, so I'll just cross nauseous out. You can also be agitated. And why? You're thinking like, oh my gosh, I have to remember all these. Guys, you don't have to remember all these. Think pathophysiology. What are we doing? Well, guys, we're blocking these, or we're not blocking them, but we're delaying the telephone game here, okay? So we're decreasing SER for serotonin. We're delaying the sleep response, delaying the emotion, delaying the remembering. We're also delaying the determination, obsession, and pleasure. So your patient might be a little agitated if we're delaying pleasure. Does that make sense? We're delaying sleep. So your patient might be a little bit more awake. There's no sedation. We're not turning off the GABA receptors in the brain like alcohol does and sedating the patient. That's a benzo and barbiturate thing. Doing it totally different with our BoostBar drugs here. Now, with the territory, there's also different pathophysiology. Just like there's different pathophysiology with our benzos, there's gonna be different teaching. So let's get into that here. So for your patient education and side effects here, we want to teach your patients to eat meals with the meds, especially BoostBar. Really almost with anything that slows down our serotonin. Because if you guys remember from the first video, 80% of your serotonin is located in your GI tract, okay? So think, 80% of your serotonin is located there, helping peristalsis, or helping the movement of that smooth GI tract. If we're all of a sudden limiting the communication now, what's gonna happen to the GI tract? It's gonna slow down. Might get a little angry, might get a little upset. So that's why we give medications with the meals. It's not that the body's rejecting the medication, it's just that we're slowing down that GI tract. And that's usually happening with anything that slows down your serotonin, okay? Hopefully that makes sense a little bit. Now, this is a big test question. You guys can circle this. This will be on your test, I can almost guarantee it. 3 to 6 weeks for therapeutic range. Nursing instructors and the NCLEX absolutely love to say, hey, you're a patient on, atypical anxiolytic, BoostBar. They're on it for panic disorder, or they're on it for PTSD, they just came back from a war, or, I don't know, they have OCD, okay? They're complaining to the nurse that, oh, it's not working, that they like benzos better, because it's only been 1 week into therapy. What is the nurse's best response, right? So, 3 to 6 weeks for therapeutic range. We need this therapeutic range. Oops, here we go. This therapeutic range to be in range so that it takes most good effect, okay? Just like everything. Just like if you're gonna go drink some alcohol with your buddies after you pass your test, you don't want to be too buzzed and throw up all over the bar. That means you're over toxic, or basically you become toxic. You don't want to be under sober because you want to take the edge off after the test, right? So you don't want to be under the dose. You want to be right in therapeutic range, having a good time. It's exactly what we're doing here with BoostBar. Problem is, it takes 3 to 6 weeks. It's not that rapid to get your therapeutic response. So extra patient education is going to be needed all the time. I can almost guarantee you that that's going to happen with your test. So, big one here as well is there's no dependence and no withdrawal. And it's very, very less addictive. Okay. Another thing that you're going to want to write down here, and honestly, when doing the research and breaking all this content down, MAOIs are really very angry at all the other medications. MAOIs do not like to play with other medications. So really, sure you can cross out MAOIs, but honestly, MAOIs are really bad with friendliness on other medications. Usually you can't take anything else if you're taking an MAOI, and we'll get into why, okay? So no MAOIs. If your patient was on an MAOI, we have to wait 14 days after, okay? So drug-to-drug interactions, here are some top ones. No erythromycin. And erythromycin is an anti-infective, very harsh on the kidneys. So that's why we say no erythromycin. It also has a drug-to-drug interaction with our BoostBar. No ketonazole. This is anything ending in zole is your fungi, antifungal type of medication. And no grapefruit, just like with Lipitor, which is our cholesterol drug. It has a drug-to-drug interaction. These will increase effects of BoostBar, okay? So, these will all increase the effect of your BoostBar, causing more headaches, more dizziness, more agitation. So just stay away from your erythromycin, antifungal, as well as grapefruits, okay? And no MAOIs. So that's it for our anti-anxiety. Let's go on and actually let's play the benzo as well as the barbiturate lecture right now. So the difference between benzodiazepines and barbiturates almost sound the same. They react on the same neuroreceptors, and they kind of do the same thing in terms of an anti-anxiety and decrease neurotransmitters. So let me explain exactly what the difference is between these two anti-anxiety type of drugs and what are the similarities between them as well. So we usually give benzos and barbs kind of for the same things. They help to reduce a patient's anxiety levels. They don't necessarily block pain directly. They're not an opioid receptor pain blocker, but they will drop the blood pressure, they will drop the heart rate, and they will drop the respirations, because they do act in the brain, the central nervous system, okay? But their mechanism of actions are a little different. And something that you have to realize is that benzos act really fast in terms of their quick half-life. They act fast and they're released from the body very quickly. Barbiturates, on the other hand, have a longer duration, and they are usually last in the body for up to 2 to 3, sometimes 5 days. So it's a very, very high concentration. If your patient has a more propensity to get addicted to barbiturates than they do to benzos. And I'll explain what this all means. So the way I like to remember benzodiazepines, now don't make fun of my drawing, okay? But I like to think of benzos almost as like a Mercedes-Benz, okay? Mercedes-Benz. Woo! And Mercedes-Benzes, they're very flashy, nice high-end car. And I drew a little car here for you. And usually, your high-profile people, or your people who've made it in the world, drive your Benzos, okay? Your Benz, your Mercedes-Benzes, right? So if you're living a fast life, and you're on top of the world, and you have a Benz, then just remember that you're going to have girls, Pam and Lamb, in the car seats with you. So with the Benz, you're going to have, I call Pam and Lamb, because these are the two suffixes that end with our benzos. For instance, lorazepam, your other drugs that end in lam are indications of benzodiazepines. So if you remember that benzos, it's like you're driving a Benz and you have the ladies in the back seat. I don't know. Pam and Lamb are driving with you. Then it's like, it's a very, very fast life, and you're living life on the edge, and you're doing everything mother told you not to do, right? So this goes out to all my guys, right, in the crowd. But that's the way, at least I remember it, at least for your test. And remember, there's no rules in terms of how you study for your test, as long as you get this information onto the test, right? So your benzos, Pam and Lamb, very, very fast. We usually give benzodiazepines, for patients with high anxiety or a patient who comes in with a seizure. We'll usually pop an IV in them, give them Ativan or lorazepam as fast as we can to decrease those neurotransmitters and to sedate the brain. And it reacts very quickly, and it's out of the body very quickly as well. On the other hand, we have barbiturates. Barbiturates act in the central nervous system, in the brain, in the same way, but act on different receptors. They act on GABA alpha receptors, okay? And the way I like to remember barbiturates, they're a longer duration. So these guys end in barbitol. So I remember, like, we put a Barbie doll, like, Barbie and how that toy that all little girls play with. You put Barbie behind the bars, and if you're behind the bars in jail, then you're going to have a longer duration. Usually 3 to 5 days to get barbiturates out of your system. So you have a very high propensity of patients overdosing on these kind of drugs for anti-anxiety issues. Now I mentioned a little bit, but GABA receptors in your brain are thought to have the control center of your brain. It's called, my instructor always used to say, who is your controller? It's GABA. So that GABA receptor in your brain controls your conscious thoughts.
And just to let you know,
that's what it's thought to do. It's your controller. It's like your little guy in your brain that tells you to do the rational things. Now, when we sedate this GABA receptors from alcohol, we have those beer goggles on, right? That's what we're sedating our GABA alpha receptors. So, barbiturates actually act the same way as alcohol does. And barbiturates act on those GABA alpha receptors. On the other hand, benzos act on the same GABA receptors, but they act on different receptor sites of GABA itself. So
Pretty
these
good.
are very,
Thanks for your text the other day. I was just kind of busy
benzos
with
itself
teaching.
are very quick acting. They're
I
very
haven't talked to
fast,
Brenda
almost like your
forever.
Benz, Mercedes
Yeah.
Benz.
Talked to her.
And if you guys remember that Pam and
We
Lamb
talked for like
drive
almost
with
2
you,
hours.
I know.
then you can remember that Benzos, like your Mercedes Benz, ends in Bam.
It was a mix
Pam
of
and Lamb.
asking her what to do.
And remember
with
that we
it.
always
How you
give
been
this for
doing?
patients who have seizures.
I know.
Barbiturates, remember that
That's
barb is like your
Busy.
bars
Yeah,
to
just
the
like
jail.
Dang.
And if you're in jail, you're going to be there for a longer time, 3 to 5 days to get out of your system.
So,
And we put Barbie dolls behind the bars. So bar and
I was
bar,
wondering, I was like, I haven't seen it since
you're going to be able
I've
to remember that these are barbiturates. And if you remember that barbiturates are longer duration
don't have anywhere to go.
and have a higher propensity of addiction, then you're going to be able to remember and score higher if you're going to be giving
Comfortable with your
barbiturates
decision?
No.
in the clinical setting. So that